7 Diabetes Nighttime Signs You Should Know. 7 Diabetes Nighttime Signs You Should Know. Diabetes remains a vigilant challenge, even under the cloak of night. In fact, the evening hours can unveil a distinct set of symptoms that every diabetic should be keenly aware of. Recognizing these signs is crucial for timely management and uninterrupted sleep. Let's explore the 7 critical signs you shouldn't overlook when darkness descends, because diabetes doesn't clock out. Number 1. Nocturia. Nocturia is a term that might not be commonly known, palpably disruptive, especially for those with diabetes. It signifies an increased frequency of urination during the night. Elevated blood sugar levels in diabetics often lead to this condition, as the body attempts to expel excess glucose through urine. Consistently waking up during the night to visit the restroom not only disrupts one's sleep cycle, leading to fatigue and reduced daytime alertness, but it also serves as a significant indicator of one's blood sugar not being within the optimal range. For those seeking to manage this nighttime sign, 2 key strategies can be considered. Firstly, regulating and consistently monitoring blood sugar levels, and secondly, being mindful of fluid intake in the evening hours. However, if the issue persists, it's crucial to consult with a healthcare professional, as other factors might be contributing to nocturia. Number 2. Night sweats. Night sweats often manifest as excessive sweating during sleep, even if the room's temperature is cool. In the context of diabetes, these intense sweats can serve as an alarm bell for nocturnal hypoglycemia or low nighttime blood sugar levels. Several triggers can contribute to this, from certain medications and intensive insulin treatments to an imbalance in daily meals or rigorous evening exercise. Waking up drenched not only interrupts a good night's rest, but also indicates that the body's glucose has plummeted to concerning levels. To adeptly manage night sweats, it's crucial to consistently monitor blood sugar, especially in the evening. Recognizing and adjusting potential triggers can be instrumental. Furthermore, under the guidance of a healthcare professional, medication dosages might need revisiting. As a precaution, having a readily accessible glucose source, such as glucose tablets or juice bedside, can be life-saving during nocturnal glucose dips. Number 3. Restless leg syndrome, RLS. As we dive into this segment, please subscribe to this channel if you're finding this video helpful. Thank you. Restless leg syndrome, RLS, is a neurological condition characterized by an uncontrollable urge to move the legs. Often accompanied by tingling, itching, or a crawling sensation, this discomfort can escalate during periods of inactivity, making it particularly troublesome during nighttime. For diabetics, there's an observed link between the prevalence of RLS and peripheral neuropathy, a common complication of chronic elevated blood sugar levels. Managing RLS in the context of diabetes involves a multifaceted approach. Firstly, maintaining optimal blood sugar levels can potentially reduce the onset of neuropathy, and by extension RLS. Additionally, certain lifestyle changes, such as reducing caffeine and alcohol intake, can alleviate RLS symptoms. Regular moderate exercise has been shown to help, but overly strenuous activity might exacerbate the symptoms. For some, massaging the legs, applying warm or cool packs, or even practicing relaxation techniques like meditation can provide relief. Number 4. Sleep apnea. Sleep apnea is a sleep disorder characterized by pauses in breathing or shallow breaths during sleep, leading to frequent awakenings. It's particularly concerning for diabetics, as the disrupted sleep and reduced oxygen levels can contribute to insulin resistance and poor blood sugar control. Sleep apnea itself can be a result of obesity, which is also a risk factor for type 2 diabetes. Managing sleep apnea often involves a mix of lifestyle changes and medical interventions. Weight loss can be particularly effective, as even a small reduction in weight can alleviate symptoms. For immediate relief, continuous positive airway pressure CPAP machines are commonly used to keep airways open during sleep. In terms of lifestyle changes, avoiding alcohol and sedatives, which can relax the airway muscles, can be beneficial. Side sleeping is also recommended over back sleeping to prevent airway blockage. Given the interconnectedness of sleep apnea and diabetes, effective management can lead to improved blood sugar levels and overall being. Number 5. Nighttime hypoglycemia. Nighttime hypoglycemia refers to low blood sugar levels that occur during sleep. For diabetics, it's a critical concern as it can go unnoticed, leading to potential complications. Symptoms might include night sweats, vivid dreams, or waking up with a headache. Extended periods of hypoglycemia can result in seizures or even unconsciousness. Managing nighttime hypoglycemia is central to the well-being of diabetics. Regular blood sugar monitoring, especially before bed, is essential. If levels are low, consuming a carbohydrate-rich snack can prevent a nocturnal dip. Adjusting the timing or dosage of insulin or other diabetic medications under a doctor's guidance may also be necessary to quickly counteract nocturnal lows. It's advisable to have a fast-acting glucose source, such as glucose gel or tablets, within arm's reach of the bed. Educating friends or family about the signs of severe hypoglycemia and how to administer emergency glucose or glucagon injections can also be life-saving. Number 6. Nighttime frequent thirst. Nighttime frequent thirst is a telltale sign for many diabetics, particularly when blood sugar levels are elevated. High glucose concentrations in the bloodstream draw water from cells, leading the kidneys to produce more urine to flush out the excess sugar. This cycle results in increased thirst and frequent urination, even during the night, potentially disrupting sleep. Effective management of this symptom is intertwined with overall diabetes control. Keeping blood sugar levels in check is paramount. Monitoring glucose levels and adjusting medication or insulin dosages accordingly, under provider's supervision, is essential. Hydration is crucial, but to mitigate nighttime disruptions, try to balance fluid intake throughout the day, rather than consuming large amounts in the evening. Additionally, cutting down on caffeine and alcohol can help, as both can act as diuretics, increasing urine output. Recognizing and addressing nighttime thirst is vital, as it's not only a sign of elevated blood sugar, but also a potential disruptor of restorative sleep. Number 7. Nighttime cramps. Nighttime cramps, characterized by sudden painful muscle contractions, predominantly in the legs, can be distressing for diabetics. These cramps can arise due to high or low blood sugar levels, reduced circulation, or diabetic neuropathy, a nerve disorder resulting from prolonged elevated blood sugars. To manage and reduce the occurrence of nighttime cramps, maintaining stable blood sugar levels is the foundational step. Regular monitoring and adhering to prescribed medication regimens can help keep glucose in check. Additionally, gentle stretching exercises before bedtime, particularly for the calf muscles, can alleviate tension and reduce the risk of cramps. Keeping hydrated, ensuring a balanced intake of minerals like magnesium and potassium, and wearing supportive footwear can also play a preventive role. Warm baths or using heating pads can provide relief from cramps. If nighttime cramps persist or intensify, It's essential to consult a healthcare provider to explore underlying causes and receive appropriate treatment recommendations. Knowing the signs is your first line of defense in managing diabetes effectively. This not only improves your sleep quality, but also strengthens your overall diabetes management. And please subscribe to this channel if you found this video helpful. Thank you for watching.